Hello, everyone, and good morning or good day, midday to those of you in the East Coast. But for everyone else, it's out in the West Coast, or I should say, out west of the Eastern Time Zone. Want to welcome you to the Q&A study session, Unit 2, which is Biological Psychology. I posted below a link that not a link, I should say, but the question box where you can ask questions about this unit, which is the brain, endocrine system, nervous system, neurons, sleep cycles, brain waves, things like that are all part of this unit. So I'm going to go through the questions just a little bit, and I want to make sure I get this started here. So give me a moment, just fooling around here. But again, if you write the questions out, preferably in the this question and answer box as opposed to the chat, it's much easier for me to see, and I can it's easier for me to kind of keep track of, okay, I'm answering this question, this question, this question. And I'm going to get the share my screen just a little bit. So there we go, share screen. And let's see here. All right. Excellent. Whoops. All right. So just making sure that my screen's coming clear. You can see the title page. It says, it's like the actual title page, Psych Q&A Study Session Unit 2, 12 p.m. If you just give me an answer in the chat, are you able to see that right now? Awesome. Okay. So I will start answering the questions in just a little bit. There's 2 questions so far. All right. So first off, just want to give a quick plug of different activities, different psych things that are happening today and then later this week and into next week. For those of you who have the cram pass, tonight, 8 p.m. is Unit 1 Foundations, which is both the history of psych, ways psychology is practiced, and then also the research methods and statistics. That's all part of that's going to be part of tonight's presentation. Then on April 3rd, which is tomorrow, there is going to be trivia. It's some practice trivia on AP Psych Units 1 and 2. So that's stuff we're covering today. Stuff that was covered in a previous Q&A, Unit 1, that is going to be for trivia for tomorrow. Then Q&A Unit 3, Sensation and Perception, will be a week from today, same time, 12 p.m. So those are the upcoming events, and also the plug for our social media, at Think5able on Twitter, Instagram, and YouTube. And the agenda for today, it's pretty straightforward. Your questions, I know some have already been asked, which is great, and I will answer them to the best of my ability. And then a practice item, which will be time permitting. So it is something that if there's no other questions, I'll give you a practice item based upon the Unit 2, or this particular unit, and see how we do with it. So we get to the part of your questions. And the questions are, this one is, do I have any good ways to remember the parts of the brain, such as reticular formation, what they do, where they're located? All right, that's a very big encompassing question, and I will address it in parts. So the way I teach it to my students, I usually use mnemonics. I use a lot of different mnemonic devices or ways of just taking the term and making some link to it to remember. The more you practice it, the more you think about it, the more you review it, the easier it gets, and the less you review, there need to rely on that mnemonic. So once upon a time, when I first learned parts of the brain, and there was the pons, which is in charge of sleep and arousal primarily. And this is not an original mnemonic. This has been done many times. It is sleeping by the pond. So, sleeping by the ponds. That's the way I might remember it, sleeping by the ponds. Again, that's how I might remember it. But the more I apply, the more I write out an example, the more I do whatever with it, I kind of rely less and less on that mnemonic. And after a while, it just becomes a quick connection between pons and sleep and arousal. So I'll go through some of my mnemonics and what they will do. So you have the medulla. The medulla is, or the medulla oblongata, which is located right on top of the spinal cord, connects the spinal cord to the brain. The way I remember this one, and by the way, these are take it or leave it. Sometimes they're so silly, and sometimes they might work for a person, sometimes they won't. So the medulla, I think about, I grew up in the 80s and 90s, as a kid, and I watched pro wrestling. And I thought about this. There was a famous wrestler. Her name was the Fabulous Moolah. And the Fabulous Moolah was a very famous professional wrestler, wrestled from the 40s all the way to her death in the 2000s. And one of the wrestling moves they might do in pro wrestling is a sleeper hold, where they cut off your circulation, or it cuts off your breathing and your circulation. Well, the Fabulous Medulla, remember the medulla is in charge of the basic life functions, including your heart rate, your breathing, respiration. I think about the Fabulous Medulla putting on a choke hold or a sleeper hold on someone, cutting off their breathing and their circulation. That's how I remember medulla. Then you get to the pons, so you're sleeping by the pons is the best way I remember that. Reticular formation for me, it's a football analogy or a football mnemonic. So that in this case, you have these. So if you know anything about professional football, especially if a team goes to a visiting stadium where the crowd's going to be very loud and they're going to make it very hard to think, you would love the reticular formation to block out that noise, because the reticular formation, one of its functions, one of the main functions I think that we talk about in AP Psych, is blocking out irrelevant stimuli, because there's all sorts of stuff that we see, hear, taste, and we want to block out things that are not relevant to us. So that quarterback on the field wants to block out the very loud crowd noise. So what would be the best play? Well, let's get into the reticular formation. Let's get into the reticular formation, and this way it the crowd noise will not get to us. Again, that's the way I might remember that. That's reticular formation. Then we move on to, I'm kind of going through the parts of the brain here, cerebellum. And a lot of these, by the way, are other teachers use. But I think about my good friend Cerebellum, who is very clumsy, who is not very coordinated. She trips a lot. She slips on things, very clumsy, because the cerebellum helps us with balance. The cerebellum helps us with maintaining our balance, fine motor movements. And a person who is clumsy might not be able to do those things quite well. Now, cerebellum also helps with procedural memory, which is also a very important thing. So a person who is very clumsy might not be able to do things very well. So my good friend cerebellum is rather clumsy. That's how I might remember that. So then I get into the hippocampus. One of the classic ones is Camp Hippo. At Camp Hippo, memories are made. At Camp Hippo, there's lots of great things that can be remembered, a lot of things that can be remembered. Actually, on my PowerPoint slides I give my students, I have this little, it's this GIF of these two hippopotami, I guess is the plural, and they're in love with each other, and I play Unchained Melody in the background, and it has a little sign that says, at Camp Hippo, memories are made. So, and that's what the hippocampus does. It helps with storing of memories, the making and storing of long-term memories, most types of memories, not procedural, not emotional, but memories, I would say, the hippocampus, the long-term memories, semantic memories, things like that. a lot of the explicit memories. So then you move on to the amygdala, which is emotional memory. There's my friend Amy G. Dalla, amygdala, it's literally spells out amygdala, Amy G. Dalla, who can get very emotional, gets very angry, very sad, very, very happy, very, very scared, because the amygdala has to do with our emotions. So again, I'm kind of scrolling through these. The hypothalamus. So if you remember that the hypothalamus is the 5 Fs: feeding, fighting, fleeing, mating, and Fahrenheit being that 5th one, Fahrenheit being body temperature. If your body temperature gets to be too low, you might have hypothermia. So the hypothalamus hypothermia is the way I might link that. Again, that doesn't help necessarily with food, doesn't necessarily help with the other points, but if you can kind of make that connection, and remember it's the 5 Fs, F for Fahrenheit, then you can perhaps get to the other Fs as well. So you have your hypothalamus. Let's see here, your lobes. So you think about the 4 lobes, the occipital lobe, O for occipital, O for optometrists or ophthalmologists. Both are professionals who deal with eye conditions. That's the easy. The optics is also begins with the letter O. O for the optics, O for ophthalmologists, for optometrist. All those related to the eye. The optic lobe helps us process visual information. So then you have your temporal lobe, think about which does sound processing, among many other things, but in AP Psych, they're talking about sound. Keeping the tempo. So you hear sounds, you hear music especially, there's a tempo to it, you want to keep the tempo going. That would be how I might make the connection between temporal lobe and music, the tempo. So then that leaves us the frontal lobe and the parietal lobe. Well, frontal lobe, it's very easy because it's in the front. You want to make all the good, right decisions. You know, when it comes to weighing what's most important, you want to keep that in the front and center. Again, these are very loose mnemonics, but it's how I might remember. It's how I might teach my students how to do it. And so I might make that connection. Again, it's a matter of looking at these words that sometimes are rooted from Greek or other languages, and you're trying to make some sense of them. So then that leaves us the parietal lobe. And really, I've never really thought of a mnemonic off the top of my head, or it's just something that I kind of made the connection to the sense of touch. Again, these lobes do a lot more than just these things. But for me, it was just the one that was left over. The parietal lobe helps with the sense of touch. It has that somatosensory cortex, which appeared, I think, 2 or 3 years ago in the FRQ, which was literally the sense of touch, that somatosensory cortex, which was in the parietal lobe. So again, and there might have been some brain parts. Like there's other brain parts like I'm missing because I'm really literally just going through them off the top of my head. Say it in the chat or say it in the question and answer box. I'll be happy to address them. As to where they're located, I have found that the exact locations, the exact precise locations, are not quite as important as knowing where they generally are. Now, to give you an example, in 1990, I think it was the 1999 exam, it was a very early exam. It was actually question 99 and question 100. There were questions about a part of the brain. And what they did is they gave you the hindbrain, which has the medulla, the pons, the reticular formation. And they pointed to some part of it, and this was a multiple choice question, and said, what part of the brain is this? Well, the choices they gave were I think Pons was the correct answer, but then they also gave frontal lobe, I think cerebrum, which is the outer layer of the brain, basically other parts that would not be found in the hindbrain. They'd be parts found in the other parts of the brain. So it's one of those things where if you kind of know where it is, you should be okay. You should be okay. Frontal lobe is in the front. A occipital lobe, whatever made us, God, evolution, whatever you believe in, has a sense of humor. It's in the back, it's far away from our eyes. Temporal lobe makes sense. It's right by our ears, and what's left over, the parietal lobe, which is right there. Remember, this is an FRQ, and I doubt. Now, tonight, a lot of the teachers are going to find out what exactly this exam is going to entail. They're not going to, I doubt strongly that they're going to give you a brain and say, label them. I don't think that will happen because, remember, this is an open note test, and it could very easily be looked up. And they're trying to make it so that you just can't look it up and get the answer. So take that for what that is. So if you know that, okay, things like the amygdala and the hippocampus, they're typically found in the central part of the lobe or in the midbrain, then great, wonderful. That's I think when it comes to locations. So that would be, I think, just my general approach to remembering parts of the brain. And let me ask you, in the chat, has anyone ever heard of a brain dump or anything like that? Or had your teacher made you just write down as much as you remember about a topic without any retrieval cues? Does that sound, so we have one person who said yes. It's like, okay, write down as many parts of the brain as you can remember and what they do. That is actually a remarkably powerful memory trick. It seems, first of all, the idea of memorizing something, like that it just doesn't really happen. Some people have that gift. Some people now people who are able to do that typically are able to do that because they're so good at they've practiced memory every day. And so when it comes to the parts of the brain, okay, I'm gonna write down as many parts of the brain as I can remember. And I write it down and then I check my list. Okay, missed that one, got that one wrong. Why did I get that one wrong? And then the next day do it again. And what happens here is that your memory gets stronger and stronger as you do that. And the more you do that, the better you get at memorizing those things as well as new things too. So that's what I would suggest, strategies in trying to remember stuff. So, all right. Oops. There was a question about what is GABA? Okay, GABA is one of the inhibitory neurotransmitters. So there's excitatory neurotransmitters and inhibitory neurotransmitters. Excitatory neurotransmitters essentially are things that make neurons fire, that makes the action potential occur, that makes more activity in the brain occur. And there's other ones where these inhibitory neurotransmitters, to inhibit means to slow down or to prevent. Inhibitory neurotransmitters, they kind of slow down the nervous system. So GABA there's actually several of these neurotransmitters you've learned about. Some are excitatory, others are inhibitory, and some are both. The weird thing about GABA, or I should say the one thing about GABA, is that it is one that many textbooks teach just simply as an inhibitory neurotransmitter, and that's it. I think dopamine's inhibitory too, but don't quote me on that. But the point is, for our purposes, GABA is an inhibitory neurotransmitter. It slows things down. And the way one application of this is that anti-anxiety medications, benzodiazepines, the anti-anxiety drugs, such as Xanax, what they try to do is increase the amount of GABA or make more GABA or stimulate those GABA receptors so that it slows down the nervous system or slows down parts of the brain. If you think about anxiety as being a part of the brain or the brain being overactive or more active than it needs to be, again, oversimplifying the entire concept of anxiety, but if you think of it like that, GABA, increasing the GABA slows it down, calms things down. It calms things down. So that's the purpose of GABA. Now, how do I remember GABA as an inhibitory neurotransmitter? So let me see, put this in the chat. What was Fred Flintstone's famous exclamation? Does anybody remember what it was? Fred Flintstone, what did Fred Flintstone love to say? If anybody remembers, or if anybody, Yabba dabba do, right. So you say yabba yabba do, I say gabba gabba don't. I know that sounds so stupid, but that's the way I have always remembered GABA. Yabba yabba do, GABA gabba don't. And if that helps you remember it, great. And if not, as I tell my students, I tried. So that is what that's essentially what GABA is. What we need to, the purpose of GABA, I should say. So, all right. So that's that. And if you have a follow-up question, feel free to, very good. And if you have a follow-up question up, please feel free to say so. So question about left and right hemisphere and perception. So vision and touch, that for our purposes gets much more complicated than it that can go into issues that are perhaps a little bit more complicated than they need to be. However, I will talk about certain elements to this. So you have to remember that when it comes to the right hemisphere, or I should say on the right-hand side of your body, the right-hand side of your body, which might be looking like it's your left, but this is my right-hand side of my body. So the right-hand side of my body, everything goes to the left hemisphere, and everything on the left-hand side of my body goes to my right hemisphere. There are two notable exceptions for this. First, it's not left eye, right eye, it's left visual field and right visual field. Now, why that is goes, you have to remember sensation and perception research, and that the retina, there's a lot of crisscrossing and whatnot. So but it's left, right, and right visual field, not left and right eyeball. The other exception is the sense of smell, because it doesn't go in the hemispheres, it goes right to the factory bulb. That's another exception. So really what you need to understand when it comes to vision or touch is that everything on the right-hand side of your body, which to extension of vision is the right visual field, goes to the left-hand side. And everything on the left-hand side goes to the right hemisphere. So it's that crisscross. In terms of, well, the right hemisphere is the creative brain, and the left brain is the analytical brain. Those differences tend to be so minute that when you see them online, they're kind of exaggerated. And I think to get to that particular nuance is not going to happen on the AP exam. Having said that, we do know that, for example, Broca's and Wernicke's area is located in the left hemisphere for most people. And so when it's said to be a language processing part is the left hemisphere, that might be a fair thing to know for the AP exam. But it wouldn't be something where music is going to be on the right hemisphere. Based on previous questions, they don't get that precise because, again, what the research shows us is that those differences are so small that they might not be terribly important. So, but I think it's more important to just understand the left and right crisscrossing. Left-hand side of the body goes to my right hemisphere, right-hand side of my body goes to my left hemisphere. That's what I would say with respect to that. So I hope that answers the question. And if not, please, follow up on that, Tammy, please. So other questions at the moment? So, all right. What I'm going to do now is I have a practice prompt. Again, if there's any other questions, please do type them in, please write them in, please, because I do want to answer questions, as many of your questions as you can. As I did say earlier, we will find out a lot more about this test, what it's going to entail tonight. AP is meeting with a bunch of us, so we'll get more details that way. So, all right, I have a practice FRQ. Now, this FRQ is made up. It's and it doesn't have quite all the features of an FRQ, and frankly, the FRQ might be different than what we've seen in the past. We're going to find out tonight exactly what this is going to look like, or at least we'll have a better idea of what this is going to look like. So, so here is this practice FRQ. Just text a little small here. All right. Fintan is watching a movie at the local theater. He ate popcorn and drank a bottle of water, both of which he purchased at the concession stand. Part A. Explain how each of the following might affect or is related to his experience, in this case of being at the theater and watching the movie and whatever, or all the things that are listed there. Ventral medial hypothalamus, dopamine, EEG beta waves, melatonin, cerebellum. And then part B. A few years earlier, Fenton had his corpus callosum disconnected to alleviate symptoms from a seizure. Explain why this might have no impact on his, I should say his, not this, his ability to view the film. So, given that, I'm going to give you some time to kind of think about that. We'll go through these each one at a time, or each point one at a time. But first, I invite questions about this, not sure of something, comment on something. Yes, I know I have a typo or two there, but what might you, if you're looking at that, you might say, is there something where you say, what the heck is this? Or, oh my gosh, what's going on here? What would you say? Give you the time to look at that there. So we're getting an answer with the first one here from Tammy. The ventral medial hypothalamus signals the feeling of fullness. When it begins sending signals, he will stop eating his popcorn, drinking his water. I'd say that's pretty good. I'm not. Yeah, I would definitely say that's a pretty good answer right there. That would probably score the point in this fictitious FRQ. So perhaps you learn just hypothalamus, and then you get ventral medial and lateral hypothalamus. You might have not learned those two. And you're like, oh, dear Lord, I don't know what this is. And sometimes that's going to happen. No AP teacher, no matter how good that AP teacher is going to cover every single possible concept that's going to appear on the exam. If we're talking about the 100 question multiple choice test, let's put it this way, no teacher can guarantee that they're going to cover every single concept that is fair game on the AP exam. And so sometimes you might come across and say, oh gosh, ventral medial hypothalamus, don't know what that is. But so in case you're not sure of the difference between the two, the lateral hypothalamus is what makes you feel hungry, and the ventral medial hypothalamus is what makes you feel full, as what Tammy said here. The way I remember this is lateral, fateral. The lateral makes you fateral. The lateral makes you hungry. The lateral makes you very hungry, makes you want to eat. And then after you eat for a while, your ventral medial hypothalamus makes you feel full. So in this particular thing, unless they change things around for this FRQ, based on previous FRQs, definitions alone do not score, and they're probably not looking for the definition. So it's not just defining the ventral medial hypothalamus. It is something where you might want to, really apply. Well, you would have to apply it in this case. How does this affect Fenton's ability to watch the movie? So, okay, he's watching the movie, he eats enough popcorn, and then his ventral medial hypothalamus kicks in and says, you've eaten enough, I'm going to stop eating. So that's how you would score the point, and Tammy's example here scores the point quite well. All right, so that is ventral medial hypothalamus. Dopamine. Dopamine. If anyone has an example of dopamine there. If anyone's still typing out dopamine, that's fine. Let me just go back to ventral medial hypothalamus. Ventral medial hypothalamus is one of those items where there is the potential of a contradicting point. You can lose, what they'll tell you on the AP exam is that incorrect information will not lose you the point unless you contradict yourself. And Can you hear me now? Am I coming in? All right, sorry about that. I'm not sure if my internet went down for a moment or okay, it looks like my maybe either my internet went out for a moment or Crowdcast went down for a moment, so I apologize for that. Um, what was the last thing you heard me say before things went kablooey somehow? I apologize for that. That was not my doing. Was I talking? I was mentioning contradicting points. Did that come through? Okay. So, all right. So I guess dopamine. I think I'll start to talk about what dopamine does here. So Tammy has here. Um, so Tammy has a correct. Well, I would score. I would score that point. Sure. There's no rubric here yet. Let me pull up the. Let me pull up the tab again so that we have that up and ready. All right. Okay, so that's back. So yeah, dopamine does two major functions here. One, it helps us enjoy things, feel enjoyment, the feeling of happiness. So Finton is watching the movie. Dopamine is flowing through his body, and he's enjoying it. He's having a great time watching the film. Also helps with controlled movement, where acetylcholine helps us move our body, and I would say dopamine helps us control those movements. So because Finton is able to take the popcorn and take the bottle and be able to accurately move his hand to his mouth without a problem, dopamine allows him to control his movements. That would also score the point. Those are two main ways I would probably score dopamine, or that dopamine could be scored. Okay, so that's dopamine. The next one is EEG beta waves. The electroencephalogram, the beta waves. The beta. So this is where we get into our brain waves, beta, alpha, theta, delta. There's also gamma. Maybe some teachers teach gamma. Gamma's being like super alert, super awake, super zoned in, or something like that. Beta waves, this is where, again, you might have to be a little careful where you understand what beta is versus alpha. With beta waves, they correspond to the EEG on being alert and awake, being able to focus. So with that, you would have to kind of give some type of application there. Now, alpha waves are where you are relaxed but awake. So there's a difference there. Between alpha and beta, you are alert, like really alert and really focused. Whereas with alpha, you're still awake, but you're kind of relaxed, or kind of just chilled out a bit. You know, there's a distinction there. So if that appears on the FRQ and you say, well, Finton can relax while watching the film, his beta waves are very active because he's relaxed while watching the film, won't score you the point. But if you said he is alert while watching the film, or he needs to be alert, beta waves mean that he's alert when he goes out and to the concession stand and can focus on what he needs to order, that scores you the point. So it's one of those things where you have to be very, very precise and not leave anything to the imagination. If you know what beta waves are versus alpha waves, you have to be very, very precise in that application. Okay, next one is melatonin. Melatonin. So first off, any questions about anything so far? I'll give you a pause for a moment on that. All right. So melatonin is actually it's a hormone found in the endocrine system that basically helps with our sleep cycle. It helps us. It has to do with falling asleep and waking up and being alert. And with melatonin, you might say something along the lines of, well, Finton could be awake and alert. The melatonin will allow, if his melatonin levels are correct. Now, maybe forget what melatonin, is at high or low levels. Sometimes here, it just might be okay to say, well, a certain amount of melatonin will help him stay awake. He doesn't say if it's too high or too low. Technically, if you say his melatonin levels are too high, he might fall asleep and miss the film. Or maybe Finton is staying up way too late, and so he goes to bed very, very late. Now his sleep cycle is thrown off. Maybe he might need to take melatonin to fall asleep after the film or something like that. That's a kind of a weird application, but probably would score you the point. Cerebellum. With cerebellum, that's with procedural memory. Finton knows how to eat. He knows how to put popcorn in his mouth. He knows how to drink from a bottle because of his cerebellum. He is able to unscrew the cap from the bottle of water, the bottle of soda. This is a fine motor movement, which the cerebellum helps us with. He's able to do that thanks to his cerebellum. When he's standing in line at the concession stand, he won't fall over. He'll keep his balance because his cerebellum helps him with that. So that is an application of cerebellum. All right, part B. A few years earlier, Finton had his corpus callosum disconnected to alleviate symptoms from a seizure disorder, I should say. Explain why this might have no impact on his ability to view the film. So here you might say, okay, corpus callosum, what does that do? Why did, you might have learned about split brain patients. Maybe you would say in the FRQ that Finton is a split brain patient. But it actually goes back to the question about what does the left hemisphere and the right hemisphere do? Remember that, so even though the right-hand side of my body goes to my left hemisphere and the left-hand side of my body goes to my right hemisphere, with those limited exceptions, the corpus callosum is what connects those two hemispheres of the brain. So everything that's on my right hemisphere, this is my right, goes to the left hemisphere. Will find out because I have the corpus callosum right here. And everything that's in my left hemisphere will go to my right brain because my corpus callosum is right here. So those things, it allows those things, the communication between the two. But if a person has, let's say, a seizure disorder and they have to cut the corpus callosum, the deficits they have are very rare to find in everyday life. It's only when they are staring at a target and they're only shown things in their left or right visual field. How would you score this point? Here, it might be a case of saying, well, the fact is that both brains know what's going on because the left ear and the right ear and the left visual field and the right visual field are all seeing and hearing the same thing. Basically, it's not being restrictive. I'm in a movie theater. It's not like one visual field or one sound field is being inhibited, or like I can't see certain things because I'm kind of experiencing everything all at once. So both hemispheres are getting the message, and my corpus callosum, the fact that I don't have one is not really hurting me there. Again, that's in itself is not really a likely question you might see, but one that certainly might help you think about the higher order thinking that might be required of this FRQ. Again, if you got a question like that on the FRQ, it's an open notebook test. Well, okay, if you start Googling corpus callosum, it's not going to give you the answer right there and then. To actually find the answer by looking it up, it might take you 5, 10, 15 minutes. Okay, fine, but remember, you only have 45 minutes to take this entire test. So that's how they kind of, that's how they're probably going to devise this test, so that it's going to require some higher order thinking, where you can't simply just look it up. Okay, so that is the practice FRQ I have here. Are there any questions in this Q&A else that I can answer on Unit 2? Make sure anything else you might have, anything else I'm happy to answer. And of course, there will be Q&As. I think there's going to be a cram Q&A coming up. There's going to be a number of different opportunities, I think, to ask questions. There's also in the community, there's prompts, practice FRQs, similar to the one that you see here, where you can just practice application. I do plan to go in and, because I know at least 1 or 2 students have given their practice FRQ submissions, and those are optional. I mean, nothing's required here, obviously. And I'll give my thoughts as to whether or not that is a likely scoreable response for each item. that they might respond to. So with that, folks, I will conclude for today. Thank you very much for your attendance and your questions, some very good questions. Hopefully it's given you some insight and some direction on how to prepare and study for the AP exam. And if you're going to be in for future sessions, future Q&As, crams, trivia, I hope to see you there. With that, folks, have a great day and take care.